hearing me too, because I haven't seen these slides. So we're going to kind of have some fun going through them together. I got into the office last night after the assistant had left. I scribbled all kinds of notes and things and left them there, ran in this morning, grabbed the stick, and off I went. And for those of you who know Coleridge, we didn't do too well on the first slide. That should be all the boards did shrink. But I've always liked this particular quote because to me it sums up what water's all about. There's always lots of it there, but if it's not safe and potable, we certainly have significant problems. The second reason I put this slide up here is this conference is about water. So that's the only slide I have that has anything to do with water. And so I thought that was a good way to start. But, and this is a true confession, I am a reformed water terrorist. And this goes back. First, I'll go to the second slide. Yeah. All right. And I'm going to go into this slide in a moment. It serves two purposes. Before I went to medical school, I used to be a construction high steel worker with my father. That's what he did. And when I started, I was an apprentice. And the job of the apprentice was, to be sure the water pails were filled. And I always got the water pails filled. And one summer day, it was really hot, and I was going to be a nice guy. So I went out and got a couple of dozen lemons, mixed it all together, put some sugar in, and we had lemonade. Well, the people on top loved it. They drank it and really had a ball. Next day, totally unexplained, we lost about 50% of the workers who didn't come in, and never occurred to me what had happened until about 7 or 8 years later. I'm in public health school, and we're taking basic epidemiology and foodborne infections. And they said, and there's, some things are man-caused when you do stupid things. I said, uh-oh, they must be starting to talk about me here. And sure enough, one of the mechanisms was if you expose a magnesium or zinc-lined pail, which the old water pails were, to an acidic solution, you leach out the heavy metal, that causes GI irritation, and the people the next day spent more time in the bathroom than they did up with us. So, you got to be extremely careful. A lot of these things will happen accidentally, even though you may interpret it a different way. Now, what does this slide represent? Most people, when they look at it, they say 9/11. But it's not 9/11. This slide, or this image, appeared in the New York Times magazine in 1963. And the reason it was there, it was a group of citizens who were adamantly opposed to the construction of the World Trade Centers. And the argument they finally used to try and sway against the building of the towers was that they were a target for a potential airline crash. And what they were doing was playing to the fear of people. And the reason I use this slide is twofold. Number one, you can't always trust what you see. But number two, so much of what we do in our policies relating to disasters, the prevention and response to disasters, is based often on policies that are generated from fears. Oh my God, we're going to have a smallpox attack, or we're going to have an anthrax attack. And all of a sudden, for the next year or two, we put all of our vision, all of our resources on that particular item. And I don't believe that's what we need. I think we need to be informed by science, and our science has to inform policy. And we can't do that as a medical profession. We need all of us to be able to affect those kinds of change. I know we're going to be running out of time, so I'm going to run very quickly through my slides. But that to me is the most important message that I try to deliver. The reason I'm not going to be talking about water specifically today, I'm going to run through what we do with the groups that I'm associated with. And that is, how do we prepare people in an education and training way to be able to cope with these kinds of events. And it doesn't matter if you're a doctor or a nurse or a hospital worker or a street cleaner or whatever. When something happens, you may be a medical first responder. One figure I am going to give, because most people just aren't aware of it, if you look at the epidemiological evidence that's available, and you look at large events like earthquakes, especially the ones in China, the one we had in Pakistan, 50% of life and limb retrieved is not from a medical first responder. It's from your neighbor or your family member or someone like that. It's going to be 4 or 5 or 6 hours before an actual trained responder is available. So if we're going to really be ready to be effective, we all need to have this public health preparedness as kind of a secondary calling. I'm with the American Medical Association, but the work we do is not of, by, and for doctors. It's for all health professionals, all potential medical responders. This is something that took a while to get our 3 AMA presidents, the last 3 we've had, to make this statement. Every physician has a secondary specialty, and that's public health. And in my perspective, that's public health preparedness. And you all have that secondary specialty as well. I don't care if you're a banker or an engineer, you've got to be concerned with preparedness. We did a survey a while back on who would respond. And this went out to physicians and later on to nurses, and the numbers stayed the same. And the first question, would you respond? Do you have a duty to respond? 80% yes. Have you been trained to respond? Are you equipped to respond? 20% no. If we're going to recognize an obligation in people to respond, we have an obligation to give the proper education and training. I'm not going to go through this. This is the heart and soul of a series of courses that we put on. It's called the Disaster Paradigm. It is certainly not perfect, but it gives us a common way to think. How do you proceed through an event? And how do we proceed through an event in such a way that I can talk to you or you or you, and we'll all have the same understanding of what's involved and what has to be done. Lately, we've developed our pre-disaster paradigm. And this is, I feel, much more important than the actual response. That's the preparation for response. And for that, we need planning. You need resourcing. All those big trucks and boats and reserve water supplies, countermeasures, whether it's a flu vaccine or whatever it happens to be. And then finally, the education and training so you can use everything effectively and efficiently.